Hello, Athens. I'm your City Manager, Seth Sumner, with your daily COVID-19 update. It's Friday, April 3rd, 2020. We just received the most updated Tennessee Department of Health numbers for the state of Tennessee, and I wanted to share those with you right now. There are now 3,067 positive cases in Tennessee, and that is out of now 37,839 tests. There are 293 hospitalizations. We have unfortunately seen another increase in fatalities to 37, and there are now at least 248 Tennesseans who have fully recovered from COVID-19. I will share McMinn County's number with you in just a few minutes. But as I had mentioned yesterday, I wanted to go kind of data heavy with you today and look at some of the information that is available to you as it is us and kind of walk through some of the information that we're able to see with COVID-19 and how namely our governors and the state of Tennessee's response continues to change and reshape these projections. So one of the main sites that we're using is up here, covid19.healthdata.org, and it is a dashboard, and you can see here it is showing you that the stay-at-home order that was issued yesterday by Governor Bill Lee has not been implemented. We, of course, know that is not true. This is not updated every day. Tomorrow, this will be updated on the 4th, Saturday. So if you would like to pull this up on your own and take a look at it, and hopefully we'll see how this trend changes. We did, on March 20th, close all educational facilities across the state, and that was voluntary. And so here in McMinn County and the Athens City School System, as well as Etowah and other surrounding systems, those directors of schools met and collaborated and chose early on to close their facilities, and we think that was a very good move. On March 30th, we saw non-essential services closed, and there's a specific list of those types of businesses that was in Executive Order 21, and which was a follow-up to Executive Order 17 that names specific businesses to close down. And so I also told you that we would follow up with more detail on Executive Order 23 that came out late yesterday, and we will do that in just a few moments. This chart right here is showing our projected peak based on these assumptions coming at April 19th. So still 2 weeks away from our peak. And this pink line is showing you the hospital beds that will be needed. And then we'll also be looking in the green at ICU beds needed. And then your blue line down here are the number of ventilators that are going to be needed. And I'll step to the side of the screen so you can see that a little bit better. What this peak is showing us, I've highlighted here for you, is on April 9th, we are projected to run out of hospital beds in the state of Tennessee. This is all across the state. This is showing that our total need will be 15,618 beds. We have 7,812 beds available. This is showing a potential shortage of 7,800 beds. We're also showing a need of over 2,400 ICU beds, whereas we only have 629 available right now. That's a total shortage of 1,800 projected beds. Now, of course, as I said a moment ago, we do believe that this trend is going to fall. This surge rate will fall as the governor has implemented the stay-at-home order. But April 9th is right now projected to be the day where we run out of hospital beds. And so what we heard from Governor Lee yesterday is our state working with the U.S. Army Corps of Engineers as well as FEMA to make sure that we're able to prepare for that surge capacity. That's when the most people are going to be infected with COVID-19 and are going to need assistance and hospitalization. So the governor's looking at adding 7,000 beds, and we'll go back and look. Bed shortage, 7,800. We do think that should fall with the stay-at-home order, and Tennesseans being responsible and doing what we need to be doing, as we've been doing here in McMinn County and the city of Athens. So in order to create those 7,000 new beds, we're bringing in new resources, and Music City Center in downtown Nashville will be converted partially into a hospital room, hospital center with several new beds being added. They're looking at 1,600 hospital care, and this is non-acute care, so not the most serious cases, but still requiring hospitalization. We see in Memphis, the Gateway Shopping Center will be reopened, and they are working to convert that facility into health care to handle those non-acute patients. And then Chattanooga Convention Center and the Knoxville Expo Center also bringing in East, Middle, and West Tennessee resources as centers to make up for the difference in the potential hospital bed shortage. I did include this for you. Any healthcare professionals, especially nurses, that may be furloughed or laid off, if your licensing is still good, please contact the Tennessee Department of Health's website. Please go there. They need your assistance. We can add the beds. We need your assistance from the healthcare professionals to help us take care of those patients. So that will be the next big item that we're focused on. So jumping back into the data, still at thehealthdata.org, and this specific data set is coming under the guise of the University of Washington. The White House is looking and utilizing some of this data, and so we are trusting in these models. But please keep in mind, they are models. They will not show the absolute. We don't know absolutely will be here. This is a best guess based off of the information available to us. So here we saw the last time this was updated was on April 1st, and it will again be updated on April 4th. This is our peak of deaths per day from COVID-19 in the state of Tennessee, and it is showing 165 on April 20th. This is why it is so important that we are doing the responsible things, that we are staying home, that we're only making essential trips, such as to the grocery store. If you can at all go alone, adults, do not take children, don't take the elderly. If you can make a run for someone else and you're a healthy individual, please help our neighbors out, but let's limit those trips so we can hopefully never get to this point where we're seeing that number of deaths per day. Total deaths in Tennessee projected. What I wanted to point out in this data set was on April 1st, projected were 32 deaths. Now we did reach 32 deaths, but only yesterday on the 2nd. So our actual deaths on the 1st were 24. This is good news as far as we are far less than what's being projected so far. And we certainly want to see that trend continue. But projected as of April 1st, just a few days ago, our projected number of COVID-19 deaths in Tennessee looking like in the 3,400 range, 3,400 deaths. And that's what we're trying to prevent by staying at home right now and for the next couple weeks. So we look at a new data set here, another dashboard that's offered by the University of Tennessee out of Knoxville, and also Tennessee Economic Development, all kind of data sets being put into here. We've got the Tennessee State Data Center inputting data. Confirmed cases are now in 84 counties across Tennessee, where you can see the highlighted areas by size of the bubble here, how many cases are in which counties. The number of hospitalizations, and I just updated these numbers. These were not updated as of the start of filming. But hospitalizations are up, recovered are up. Confirmed cases are up over 3,000 right now today that we've learned, and deaths are unfortunately up. And so this is a very good data set that we've been keeping an eye on as well. And this is not projecting as the previous data set was projecting, but this is actually showing the most up-to-date information as it is. Negative tests up to yesterday, almost 32,000. Total confirmed cases, you can see the growth. Every couple days, every 4 days, this data set growing exponentially. And you can see here where we were yesterday. Looking at this data set. Now, I was saving this for you because I think this continues to be a blessing for our community, and good news is McMinn County COVID positive tests. You saw our first test positive on March 20th, and you saw the county mayor, myself, and our sheriff come to you and make that announcement on the 20th on this Facebook page right now. We saw our second positive test on the 22nd, and that stayed for 3 days. And now, today, we remain again at only three confirmed cases of COVID-19 in McMinn County. That is 10 days that we've remained at 3, and that's thanks to you. That's thanks to all of our citizens being responsible, using proper hygiene, limiting your interactions with other people, following the CDC and White House guidelines. We can't say thank you enough for doing that. And now we're under a stay-at-home order, so hopefully we can continue to keep this number as low as possible, as close to 3. And just another way of looking at that state data of how those cases, the new confirmed cases, are coming in. And you can see spikes and lulls here in the data sets, and those are likely because it's over the weekend and there are fewer tests, fewer clinics open, fewer tests being given, and then another spike through the week as that data is returned to us. Another way of looking at it looks like chicken pox, but you can see each county highlighted with the severity of the number of cases shown here. And then again, new confirmed cases and the growth, the spread of the virus you can see in these pink dots, and you can see McMinn County remaining a very small pink dot, and we pray that that continues. I did want to inform you, as I have stated previously, that McMinn County does have an assessment site here, and it is with our McMinn County Health Department at their address. So if you have the symptoms, if you are coughing, sore throat, short breath, fever, and you have a likelihood of encountering someone with COVID-19, having encountered someone, then you call your primary care physician. They'll set up the testing. You can work with our health department, give them a call, and they can help walk you through what the steps you need to take as far as getting tested. And so I did want to show that map with you. One of the things that I left you with, we were running a little bit later than we liked to yesterday, but we wanted to wait and see what our governor had to say. And we weren't able to actually get the printed copy of Executive Order 23 by the time we were on air. And so we wanted an opportunity to get that, to go through it last night with the city attorney, with the police chief, myself, other officials, just to make sure that we're able to properly report back to you what 23 Executive Order does for you and for our community. And so I wanted to actually turn that over now. I've got a guest who you all know, and we'll welcome back in front of the camera for us is Police Chief Cliff Couch to give us an update on Executive Orders 22 and 23, what that means and what that enforcement is. Chief?
Thanks, Seth. So what these orders in a nutshell mean is that, like a lot of other states right now in the U.S., is we do have a stay-at-home order. This is a legally binding order. If somebody violates this order, you can be charged. So this is a legally binding order. It says that you have to stay at home. You can't travel to go anywhere unless you're heading to an essential service. Now, there's where the catch is. An essential service is there's a lot of stuff that they have put into this category. Remember, this isn't something that the city of Athens has put out. So, you know, if you think that the order is too lenient, or if you think that you don't like the order, you don't like the idea, that's not something that we can fix. That's something that comes from the state. This is what we all have to work with and live with right now. And so the thing is that this is legally binding, but there's so many exceptions, if you will, because of what's considered an essential service, that this is going to be very, very difficult to enforce. So at the end of the day, we come back to where we started, where we're still going to have to rely on common sense. We're still going to have to rely on people doing the right thing, people not going out and exposing themselves to other people unless they absolutely have to. That is what we're still going to have to rely on, because this is stuff like this. There just really are a lot of issues with how these things could be enforced. So, you know, that being said, the law never substitutes for common sense. It never has, it never will. And we're going to have to rely on ourselves, rely on our neighbors to use common sense at the end of the day with this. There really are too many details as far as what constitutes an essential service for me to explain every one of them. Generally speaking, it's going to get food, going to get medical care, stuff like that. But again, there are a lot of other things in Tennessee that are going to be considered an essential service that you may not see in some of these other states that have chosen to take a much more restrictive approach. So, you know, the reality is this is not martial law. This is not, you're very likely not going to see checkpoints and all this kind of stuff that maybe you're reading about in some other states. We're going to have to rely on common sense. We're all going to have to use common sense to try and discern when we go out and when we expose ourselves to other people. That's what we're going to have to count on here locally, and I think generally in Tennessee, that's what folks are going to have to count on.
All right. Thank you, Chief. I did have one other announcement to make. We just sent out the press releases within the last hour. The Friendly City is further closing down on access to certain amenities in our parks, but we are not closing our parks. We want to keep those open for you so that you have access to take you and your family, can go on a hike, go on a walk, do some fishing, that you can take advantage of our wonderful park system. We have 10 parks. We have 10 parks total, over 240 acres of parklands that we keep up, maintain for you. We want you to be outside, enjoy this beautiful weather. Parks are listed as essential on the governor's order, and so we want you to be healthy. We want you to be out and enjoy these parks, but what we're having to do is make sure that there is no one-on-one contact between you and other people. And in order to prevent that from happening, we're gonna take away the amenities temporarily so that we can help further abide in our governor's orders. And that means taking down some of the tennis court nets so we can separate people. We still want you out there playing tennis. That's not a contact sport. However, soccer goals are having to come down. Basketball goals are having to come down. Anything that you can think of that you would reasonably be in proximity to another person, the possibility of direct contact with another person, we're limiting that as much as possible. We want to leave the nets up for disc golf. That doesn't require close personal contact. So we want to keep as many options on the table for you, but please limit that contact. You can drive, come to our parks with your family. You can use the picnic tables that we have set out, but make sure that you're staying away from other people. You're in groups of less than 10, and that you are separating yourself during those activities. I also want to take this opportunity to highlight some of our lesser utilized parks so that you are aware of all of the incredible assets that are available to you. And that is our Eco Park. We have a new footbridge. There's a walking trail, fruit trees, a pavilion. You can take your family and have a nice picnic lunch there. So please enjoy that. And that is on the way to Mid-Lab behind Denso on the other side of the interstate. We have Veterans Park. I think this would be a wonderful time to take the family and pay respects to our heroes. Our McMinn County heroes and the people that really brought us and helped us maintain our freedoms, our liberties that we get to enjoy as Americans and as Athenians. It'd be a good time to go pay our respects to those heroes in Veterans Park. We also have the Eureka Trail. A lot of people are using this now because it's such a wonderful trail for you to get out on and not be in close proximity with other people. You can ride horses, ride your bicycle, walk, jog, enjoy that asset. And it will be extending in the near future over all the way into Inglewood. So you'll be able to go all the way from the city limits of Athens to Inglewood on this trail. There's also Market Park downtown. I've talked about our free Wi-Fi that's available. Go downtown, walk around in the open green space and enjoy that amenity, and you can also utilize the free Wi-Fi that's available through Athens Utility Board down there. And then also our wetlands. Wetlands right outside of the E.G. Fisher Library. Library is closed right now, but you can go online and find programming for you and your family from the library. But the wetlands is a park that helps save a large part of our community and our downtown from flooding, is why that was even built. And so it's purposefully only mowed by statute twice a year. So yes, it looks overgrown, but that's because you have to have those healthy plants there to draw up the moisture after good rains and hold it so that homes and businesses in our community are prevented from flooding to the greatest extent possible. I took my family this past weekend. We went down and had a beautiful picnic, walked there, took a picnic lunch, enjoyed the arboretum there, walked the trails, and then walked home. And so staying healthy, staying fit is very important, and also helping us otherwise healthy folks stay healthy and prevent this virus from causing harm to us. So please get out and enjoy our parks, but again, we did take away certain amenities to try to further prevent interpersonal contact with sport. So with that, I do want to reiterate what you've heard from our governor, what you're hearing and seeing across the state was being broadcast right now is do your part, stay apart. We know Athenians are doing this because our numbers here in McMinn County are remaining at 3. I'm so proud of you and everything that you're doing to be responsible, to hold each other responsible and accountable for keeping this virus at bay and out of our community, out of our homes, and out of our vulnerable populations so we can keep that death count from rising. It's everybody's part. We all play a role in this. We can all be the hero. And that's what I'll leave you with today. May God bless you, and may God bless Athens.